Hi, my name is Claudia Glasspool, and today I will be talking to you about a heart condition under the name of atrial fibrillation, also known as arrhythmia. So arrhythmia is essentially a problem with the rhythm of the heartbeat. When a person is in arrhythmia, their heartbeat can be irregular, meaning you'll either beat too fast or too slow. But before we get into more details, I'd just like to give you an overview of how the heart works. The heart is a muscle that is approximately the size of your fist. The heart consists of four chambers. The upper two chambers are called the atria, and the lower two chambers are called the ventricles. And the purpose of the atria is that they pump blood to the ventricles, and the ventricles are large, thick, and muscular chambers that do most of the heart's work. As you can see in my diagram here, this is an overview of the inside of the heart, which consists, as I mentioned before, here is the right atrium and the left atrium, also known as atria, as well as the right ventricle and the left ventricle. So now that we understand how the heart looks, let me explain how it works. So for the heart to function properly, the four chambers must beat in a coordinated method. The heart has its own electrical system that causes the heart muscle to contract and then pump blood. That's what causes the heartbeat. So for the heart itself has a natural pacemaker in it, placed in the upper right chamber, known as the atrium of the heart, and it's called the sinoatrial node, the SA node. So as you can see in my diagram right here, this is our natural pacemaker that we have in our own heart. So the SA node directs out electrical signals that move throughout the atria and the ventricles, in which causes the heart to pump blood to the body, making you function. In a regular heart conduction system, the atria beats a fraction of a second before the ventricles, providing a lift to the ventricles. As you can see, there's another diagram in front of me. This diagram is showing a regular heart and a heart with arrhythmia. So the regular heart shows that there's a nice fluent blood flow from the atrium to the ventricles. But with arrhythmia, the blood can't flow at a constant rate. It's always changing. It's either going too fast or too slow, causing it trouble to move effectively down to the ventricles. As I mentioned before, the main difference between a regular heart and a heart with arrhythmia is the rhythm of the heartbeat. So if you have arrhythmia, your heartbeat can either be extremely fast, which would mean more than 100 beats per minute, and that's known as tachycardia. It could also be extremely slow, which would consist of less than 60 beats per minute, known as bradycardia. And for an average heart, like a normal heartbeat, is about 75 beats per minute. So if it's too fast, it is significantly over, or if it's too slow, it is significantly lower than a regular heartbeat, making it quite inconsistent for the human being who's suffering with arrhythmia. Arrhythmia is not a condition that you are born with. It's a condition that you can develop as you age. It is more for the older population. Roughly in your 40s and high 30s is when you will start to get arrhythmia. And some symptoms for atrial fibrillation consist of angina, some chest pain, some shortness of breathing, dizziness, palpitations, like feeling butterflies in your chest, fainting or near fainting, and you feel quite weak and fatigued. A major component of arrhythmia is that it is hereditary. And in my case, my father is a patient of arrhythmia, and I decided to just pursue it and do a bit more research on it because since it is hereditary, chances are I will most likely get it when I'm older. Even though it only affects about 1% of the population, it takes away 30 to 40% of the athletic capability of an athlete while they're on it. So this is huge for athletes. Like if you're a marathon runner and then you get arrhythmia and you're out on your run and you just get arrhythmia because it can come at any time, it means that you have to walk home and you have to basically forfeit your race because your heart can't handle it. And that can be extremely frustrating for an arrhythmia patient. So there have been a few cures or a few ways to deal with these conditions, which consist of, first of all, of medication to control the heart rate and rhythm, medication to thin out the blood, make it easier to flow, or cardioversion, which is controlling electric shocks to the heart. And the last one, this is the main one, it's this involves a surgery. It's called an ablation. So where they essentially go in your heart and destroy the area of the heart that's causing the malfunction. And they also insert like a pacemaker to help regulate the heartbeat. However, in some situations, arrhythmia can get pretty serious. So there's the instance of a stroke. When the heart isn't pumping properly, it causes blood to collect and it forms clots. And these clots can transfer all the way up to the brain and causing the brain a blockage in the brain, which will cause a stroke, which then can be fatal. It can also cause a heart failure because prolonged tachycardia, when the heart beats too fast, or bradycardia, the heart beats too slow, will result in insufficient pumping. It won't be pumping enough blood to the body and its organ, making it collapse and shut off. So there are the few odd circumstances where arrhythmia could be fatal, but in most cases it is just a disconvenience more than anything. And for some people, all it is to cure it is a change in nutrition or in changing their ways. My father and all his brothers have arrhythmia, and my one brother quit drinking alcohol for 1 year, and that cured it. My dad tried the same, and he's still living with it, and he had the ablation, and he's surviving just fine and going into arrhythmia less and less. So it's different for each individual, and individuals who have arrhythmia will have to try more than one cure or treatment to see what works best for them.